Hi, everyone. Welcome to our event. We're going to kind of get started here. We have a lot of people on Zoom who are waiting to hear our great presentations, and we also have some people here in person as well. My name is Sarah Dickens, and I'm a clinical research coordinator for our CCO team. And we also have AIM at Melanoma Foundation here with us, as well as the CU Center for Rare Melanoma. So we'll go ahead and get started shortly. We also have Sam, the president of the AIM at Melanoma Foundation, here to talk for us as well. We have an amazing lineup of speakers, including individuals who specialize in research, pharmacology, physicians, investigators, licensed professional counselor, and a speaker, advocate, and patient herself. So please help me welcoming Sam to the podium, and she'll help us get started. Thank you.
Oops, thanks.
Yeah, of course.
Hi, can you guys hear me? Oh, there we go, much better. So we're gonna get going. Just give us a second, apologize. This is, I think, our first in-person event in a very long time. So we are now working on just sort of a little bit of coordination on our part. So please bear with us. So yes, hi, I'm Sam Guild. I am the president of AIM at Melanoma. I want to thank everybody who's here in the room. I also want to recognize the people who are joining us via live stream. In the new world, most people now join virtually, and makes a lot of sense. People are very busy and lots of things to do. I want to begin first, of course, by thanking the University of Colorado Cancer Center and the Center for Rare Melanomas. I've been wanting to personally be here in Colorado for quite some time to run one of these events. So I'm really excited that we are doing this morning. I also want to, though, point out and just mention a couple of people, a small handful of people who, but for them, this event would not have been possible. There's the co-directors, of course, for the Center of Rare Melanomas, Dr. William Robinson and Dr. Casey Coots. Thank you so much for your support. There's, of course, our co-organizers here at the university, Sarah Dickens, Ashley Tulio. Thank you so much. We have a couple of volunteers here this morning, Alexis and Jessica. And I also want to personally thank Ann Garst-Taylor, who is our Director of Community Engagement. This is her first in-person event. So Ann, thank you so much. I'm just going to go over a couple of logistical issues first. So please bear with me. I'm trying to juggle between in-person and online. So if you hear something that doesn't relate to you, I promise I'm going to hopefully address something for everyone. So if you're here in person, you have a folder. There's an agenda inside that folder, and there's also a survey that we included. Please fill that out. We do lots of events, toolkits, resources, and we look at your surveys. If you're joining us online, you will receive an email after this event. Please fill it out, and we will make sure to look at them all. Questions, we do have a Q&A near the end of this morning. If you're here in person, we have index cards inside. You write questions on. If you're joining us virtually, either comment if you're on Facebook or YouTube in the comment section. If you're on Zoom, in the Q&A, we are going to collect all those questions and answer as many as possible. If we don't get to it, I apologize. Please reach out to us, and we'll have our physician assistant here at AIM respond to you. We do ask that the questions be general in nature. We want to protect everyone's privacy, and certainly, questions regarding your specific care should be directed to your healthcare provider. We are recording this event, so if there's something you missed, you want to see it again, you want to share it with someone, the presentations will be available afterwards. There is something, though, I do want to just take a couple of moments, so please bear with me. And there's a story that I promise, that I just want to share with you about how much things have changed and how much there is a future to ending this disease. So I've been in the space, I should let you know, for many years. I've been in the melanoma community now for close to 19. And I was talking to a medical oncologist a few months ago, and we were talking about stage 4 melanoma. And we were talking about treatment options and decision-making. And she actually used a word that I had not ever heard in this context in the 19 years that I've been in this space. So my sister, I should let you know, was diagnosed with stage 4 melanoma in 2003. And the overall survival for patients at that time was 9 months. Really, it was one treatment option. There's a reason why we don't use it really anymore. But the word that the medical oncologist used was the word cure. That is not a word I had heard in this context of stage 4. So again, putting things in context, when my mother, who later started this foundation, was caring for my sister, there were no resources, very little research. In fact, when she was going to the oncology meetings and I would join her at these oncology meetings, there was few people in this room. It's completely changed. Now you go to these oncology meetings and it's packed and there's lots of great data. And that's because for patients now, for some of them, there is a cure. And I share that with you because there is hope. When I did these events for many, many years, we wanted people to leave these events with hope. And now I know when these events end, there is hope. So we are all here to help you. We are here to support you. And I hope, again, when you end this event this morning, what you walk away is with hope, because it does exist. Thank you.